Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about how to decode your nuchal translucency images, as well as what to expect during your nuchal translucency ultrasound. So, for those of you that don't know, the nuchal translucency ultrasound is done at around 12 weeks. The guidelines do state that babies should be between 45 to 84 millimeters, although at the clinic that I work at, our cutoff is at 80.9 millimeters, and that roughly translates to about 11 to the end of the 13th week in pregnancy for baby. So basically, baby can't be too small and it also can't be too big, or else the measurements of the nuchal translucency is going to be inaccurate. And the nuchal translucency measurement that we are trying to see on ultrasound is going to be fluid at the back of baby's neck that accumulates at that point. It's a very normal thing to see fluid, all babies have it, but it is the thickness of that measurement, or basically how much fluid is at the back of baby's neck, which is going to be one of the factors that determines whether or not baby has a higher risk of having a genetic abnormality present. So, the overall risk factor that you are going to get back from this test is going to give you the chances of whether or not a baby has an increased risk for genetic abnormalities. But this is not going to be definitive in saying whether or not they are actually present. You can think of this as just one of the screening tools that we use, similar to the NIPT blood test, that is going to say whether or not your risk is increased. And then if you want to have further testing from there on out, as in get a CVS or an amnio done, which is invasive testing that actually looks at baby's DNA, then absolutely you're more than welcome to do so. And usually, if your risk does come back increased, these options will be presented to you at a high risk clinic or maternal fetal medicine. So, your overall risk factor is going to be composed of three things. It is going to be made of the nuchal translucency thickness, so that is going to be obtained via the ultrasound that you get. The other part of it is going to be the blood test, so they are going to take a blood draw the same day that you get your nuchal translucency ultrasound measurement. And then the third thing is going to be just your background risks. And all three of these things are going to be combined just to see what your overall risk is going to be. With that being said, it does not mean that, again, baby does have anything genetically abnormal present if the risk comes back higher than what is expected. But there is, again, just an increased chance that there will be something there. It's also important to note that just because your nuchal translucency from your ultrasound comes back as normal, so anything under 3 millimeters is what we consider normal at the clinic that I work at, just because that is normal does not mean that your risk factor is not going to be increased, because again, there are those two other parts that they look at. And if certain factors in your blood do come back as abnormal, that may elevate your risk, and therefore you are going to have an increased risk overall, even if you have a normal NT measurement. And although you can get the scan done as early as 11 weeks or when baby is about 45 millimeters, we do like to see you for the first time for your NT scan at around 12 weeks, just because baby is a bit bigger at that point. It tends to be a little bit more mobile, so we can hopefully coax baby into a perfect position if it's not cooperating that day. And it leaves a little bit more of a margin of error in case baby is not cooperating that day and we can't get the NT measurement at that point. Then at least we have a little bit of time before baby is too big to be able to get an accurate measurement before we have to move on to other measures if you wanted a genetic screen done. So basically, if you come in at 12 weeks and baby isn't cooperative, at least we have about a week, maybe a week and a half of leeway to go ahead and rebook you again so that we can attempt the measurement again. But with that being said, if baby is not cooperative and you have come back 2 to 3 times and you don't want to try anymore, or baby is just too big at that point to be able to rebook you again to try again, then we do offer other genetic testing, as in the quad screen is usually the most common one offered, and that is going to be a little bit less sensitive than the nuchal translucency screen for genetic abnormalities. But at the same time, it is better than nothing if you wanted a genetic screen done. And the accuracy with that is about in the high 70s, I believe, as opposed to the nuchal is more in the low 80s. And the quad screen is going to be a blood test only done between about 15 and 21 weeks. But those are options that your doctor can definitely discuss with you if your baby decides to be really uncooperative during the NT scan and you guys can't actually get that measurement of fluid at the back of baby's neck. And lastly, at the clinic that I work at, we allow 45 minutes for the nuchal scan to be done. And if baby does not cooperate in that time, then again, if you're not too big to be having the exam rebooked, then we will go ahead and rebook you for a different time to try and get that measurement again. But definitely expect to be there for about 45 minutes on average. And if you have a full bladder during the scan, then that is a great thing to start off with. But we'll probably let you go pee at some point during the test just to help out baby in movement, or at least to change baby's position. But again, you can expect it to be a longer exam because baby needs to be in a really, really specific position to be able to obtain that measurement of fluid at the back of baby's neck. So now let's look at a picture of what the nuchal translucency measurement should be looking like. And this picture is taken from the maternal fetal medicine website. So basically just the site that we do all of our training through. It is based in Europe. But anyways, this is the ideal image for the most part for a nuchal translucency measurement. It is really important for us to be midline on baby, so we are getting the most accurate measurement, as well as evaluating things like the nasal bone, as well as certain brain structures being present. So if you look right down here where that yellow arrow is pointing to that second line, so basically you have that first white line and then you have the second white line there near baby's nose. That one there is called the nasal bone. NB means nasal bone. So that's the first thing that we are looking for. And then the other bright line that is on top of the nasal bone there, that is the skin line. The third thing that we are going to be looking for to make sure that we're lined up correctly on baby is going to be this little echogenic dot at the tip of baby's nose. That is just the nasal bone tip. So these three things, as in those two lines there, and then this echogenic area right here, this kind of bright dot, I guess, if you will, those three things are what we are going to be looking for in the nasal bone area to make sure that we are lined up, as well as making sure that there is a nasal bone actually present on baby. We also want to make sure that we are seeing this longer white line here. This is baby's palate. And if baby has a cleft palate, then it is in this view that we would be able to see a defect in this bright line here. But again, if we are seeing the palate here as this long white line, we know that we are midline on baby. And if we do not see this here and it is more echogenic kind of in this middle area here, we know that we are off axis and we are not going to be able to get an accurate measurement. Also, the overall image of baby should only be about a third of baby's chest. So here we're actually getting a little bit too much stomach here. So if they cut off the picture at about this point onwards, then it would be a perfect nuchal translucency picture. But we only want to see about a third of baby's chest, and then the rest of it should be baby's head. And down here, we can actually see the fluid that we are measuring. So where those calipers are and where it says NT, so they're measuring from here to here, this black stuff here, anything black on ultrasound is going to be fluid. That is the nuchal translucency fluid that is at the back of baby's neck. And we always want to make sure that we are not confusing the NT here with this other membrane that is down here, which is called the amnion. Here you can see the amnion pretty distinct, as in it's this one here versus the NT that is right here. But on some babies, it is not as obvious, and we just want to be sure that we are only measuring the NT fluid here and not including the amnion membrane over here with the fluid, because then it would falsely elevate the measurement. And again, anything over 3 millimeters is what we use as abnormal at the clinic that I work at. But I know some places do use 3.5. But when we start getting into the 3.5 or over range, that is when we have automatic referrals to high risk or MFM. And the last thing that we are looking for is this brain structure right here in the head. So you can see that it's kind of like a figure 8 looking thing. It's this dark area here in the brain. This is called the diencephalon. And again, if we are seeing this in our NT picture, we know that we are midline, and it is definitely one of the landmarks that we are going to use when we are doing our measurement. Oh, and one last thing. We want to make sure that there's some space here between baby's chin and baby's chest, and that the head isn't flexed too far back like this, or it's not too tucked like this, because again, that is going to give an inaccurate NT measurement.